Hi. One of the most common complaints that I get in my practice is aging of the lower eyelid / cheek complex. I'm Dr. Rejuvenation. I'm a double board certified facial plastic surgeon based here in Houston. The majority of my practice is tailored towards facial rejuvenation. One of the other educational videos that I put out here on YouTube explains lower eyelid rejuvenation. Some of the key points on lower eyelid rejuvenation are that there isn't a one-size-fits-all solution for every single patient. The solution really is tailored to the amount of aging that is seen within the patient, whether it is just simple loss of volume all the way out to herniated or pooching out fat with excess skin, with loss of volume, with ptosis or droopiness of the midface fat pad. So that's a huge spectrum in there. So in this video, we're going to do a little bit of a case presentation of a patient who showed up at my office. This woman is a lovely 40-ish-year-old woman who shows up at my office saying she just looks tired. She's tired of looking tired. She thinks that her eye really ages her. So when we look at this woman very carefully, one of the things that we notice is she really doesn't have a whole lot of excess skin or tissue of her upper eyelid complex. This is one of the first things that I look at. Also, her brow position is pretty good. Her main issue is this lower eyelid and interface between the lower eyelid and cheek region. And if you look really carefully on her, and the 45-degree view is probably one of the best views to see this, she actually doesn't have a lot of fat of the eyelid. What I like to do is look at the actual bone of where the orbital rim is, and above that is where the eyelid fat lives. Her fat does not pooch out. She doesn't have any fat that needs to be removed. So what's happened here is that this whole complex of the midface fat pad has actually come down a little bit, and she's lost a little bit of volume here. That makes that lower eyelid / cheek transition zone very prominent and makes her look tired. 2. The other thing she has is she has a little bit of excess skin in this area, and that skin is very thin and crepey. She's lost a lot of the collagen and elastin in this area. So this was my solution for her. What I wanted to do to rejuvenate this area was 1, do a little bit of liposuction. 2, use the harvested fat and process it. 3, use microfat to rejuvenate the bone lost volume in this area. 4, use a separate fraction of the fat which has nanofat with stem cells to build up the soft tissue volume of this area. 5, laser the entire skin in this area to tighten the envelope a little bit, thicken the skin a little bit, and smoothen the transition zone between the eyelid and the cheek mound. While we were doing this, we had some excess fat, so we went ahead and used the nanofat / stem cell portion to do a full face stem cell treatment in order to enhance the characteristics of her overall facial skin. So first of all, here she is immediately after the procedure. You can now see her at 3 days after the procedure. And here she is at the very end at 10 days after the procedure. Some of the things that we did in this specific case to allow her to heal so quickly was utilizing the Elixir MD system. The Elixir system uses photobiomodulation in a series of treatments to first detoxify the skin with the blue light therapy and then allow more rapid tissue healing using the yellow light therapy. So the patient came into the office several times in her postoperative period, and this is one of the things that we did in order to really enhance the overall recovery complex. I hope this video has been helpful in giving the viewers some ideas and options in terms of lower eyelid rejuvenation. Couple of take-home points from this video. One, there isn't a one-stop shop on how we fix the lower eyelid cheek complex. Every patient is unique. Two, this video highlights one specific patient who had kind of early on stage aging in the lower eyelid, and we treated that with volume correction as well as lasering of her lower eyelid. Three, we can speed up the recovery process by using Elixir MD in order to really enhance that healing process so that patients can get back to their normal self as quick as possible. I hope this video has been extremely useful, has been educational, and you kind of learned something from the video. If you found the video extremely helpful, please hit the subscribe button. If you have comments or questions, hit us down below in the comments section. Thank you so very much.